Are you suffering from depression? You don't feel like doing anything. You're kind of disturbed. There's no joy in anything. There's no happiness. And you used to be very happy. You used to be very jolly. You used to see the positive in everything. But now there's this dull, doom, darkness. Is it really bothering you? And you don't know what to do about it. You may have tried some medicine, some SSRIs, selective serotonin reuptake inhibitors, and it's still not really bringing back the old you. What could really be the cause? Well, there are really tons of reasons why you could be suffering from depression. It could be iron deficiency. Keep in mind, iron deficiency is the most common nutritional deficiency in the world. And women in their reproductive age are very likely to be iron deficient. Being iron deficient can also mean that you are anemic. It could also impact on your thyroid function. You could also be deficient in B12, folate. It could be due to too little omega-3. It could be due to so many other reasons. The nutritional deficiencies could be caused by gut issues. If your microbiome is not healthy, if it's not balanced properly, that can cause you to develop a number of nutritional deficiencies. It can also impact on your overall health. Gut issues are not usually limited to the gut. And you can have gut issues although you have exactly no symptoms from your gut. So, depression could be caused in a change in your gut pathogens, in your gut microbiome. There's so many other reasons why you could be depressed. Could it be your hypothyroidism? Maybe you're not producing enough thyroid hormones. And why would you not be producing enough thyroid hormones? Could that be due to iron deficiency? Could it be due to magnesium deficiency? Could there be other reasons? Could it be an autoimmune disease? Maybe your thyroid issues are related to your gut. Maybe your thyroid issues actually reflect that you have gluten sensitivity. Maybe that is causing problems with your thyroid hormones. Maybe your thyroid is okay. Maybe your cortisol level is not fine. Maybe your adrenal glands are stressed out. There could be so many reasons why you develop depression. It could be mold in where you live. You may not be able to see it. It could be hidden. And often we do not detect mold so easily. It's not easy for us to really think about mold and then properly investigate it, let alone treat it. Treating mold is not necessarily that easy. It could also be heavy metal toxicity. Heavy metal that you could be exposed to through your job or your environment. Maybe your environment when you were younger. Maybe your detoxification pathways are not working. You could have issues with your neurotransmitters. Maybe something is off with your serotonin production. Maybe your serotonin metabolism is not okay. Could it be B6 deficiency? Could it be your dopamine levels that are not okay? Could it again be B6 deficiency causing you to have problems with your dopamine? Or could it be vitamin C or copper that is causing you to develop issues with your neurotransmitters? There are so many reasons why you could be depressed. Maybe the selective serotonin reuptake inhibitors, the SSRI, is addressing one aspect of depression, but it's not really addressing the root cause. Say, if someone were to break the windows in the room I'm standing in right now, it could get pretty hot right here. Is the solution to that we install more air conditioners to bring the temperature down? Is that the solution? Well, That's kind of what we do when we give a patient SSRIs. We see there's something wrong with the serotonin, and we do something to stimulate the postsynaptic nerve with more serotonin. But the question is, you didn't used to have a problem with serotonin. Why have you developed that problem today? What do we need to do to bring the serotonin back to where it should have been in a natural way? How can we address that? Is it because you're lacking 5-HTP, the precursor for the production of serotonin? Could you be lacking tryptophan, which is the precursor to 5-HTP? Or could it be something totally different? Maybe it's not even that. Maybe your cortisol level is just totally down because you have adrenal burnout. Could that be the reason? Well, we don't know. If we don't test, we're just guessing. And if we just give you a SSRI drug, well, then we're addressing maybe one aspect of your depression. And we see quite a few patients, although they may get some relief from the SSRI, they may not be fully back to where they used to be, where they used to be happy and positive about life in general, and they were happy to meet the challenges in life. And you're not there despite taking the SSRI or maybe other drugs. If you're ready to address these things, if you're ready to dig deep, if you want to understand what factors are contributing to your depression, then speak to us. We will not do away with your depression in a snap. It will take time. We need to analyze your body, and you have to be on board. This is not just something where you go to the doctors, you get some medicine, and we are done. No, you're actually going to do the healing. I'm just going to be your guide. I'm going to be your consultant. I'm going to give you advice on what your body needs, what is happening inside your body. Is your mitochondria not working properly? I'm going to give you that information, and I'm going to help you on what changes you need to implement to improve your health. And that is my job, but you are really going to do the healing. You're really going to be the master of your health. You're really going to master your depression and do away from it from a cause perspective, or rather causes. Because chances are there are multiple reasons why you have developed depression. So if you're ready to address those things, speak to us, book a discovery call, and let's get started. Thank you for watching.